All right, so when we're talking about shared decision making for tPA, this is something that I speak with my patients about quite a lot because I work at a very large stroke center that's a pretty aggressive tPA center. So we have this conversation pretty frequently in our emergency department. I borrowed a lot of these just to give credit. One of our other faculty members who's EM and also did a stroke fellowship, Laura Heitch, has a really good way of explaining this. So I borrowed much of this from her and then kind of tweaked it to suit my own style. So if you have a patient who's come in very clear stroke symptoms and they're alert and they have capacity, so it's someone you can have the conversation with, or if they have a close family member there who's going to be kind of a surrogate decision maker, I'll have this conversation with them. So I'll say, based on the symptoms that you have with the weakness that you have and the troubles talking that you've been having for the last couple hours, and on the scan that we just did, we're very, very concerned that this is a stroke, that you're having a large stroke right now. There are some things we can do to treat that, and the first line treatment for strokes is a medication that's called tPA. And so what that is a clot busting medication, because there are two kinds of strokes. There are strokes that are caused by bleeding in the brain. That's the less common kind. Those are pretty relatively rare. And that's why we did the scan first, because CAT scans are really good at picking up if there's bleeding in the brain. So that CAT scan came up normal, meaning that there's no bleeding. But CAT scans usually can't see the other more common kind of stroke, which is a stroke caused by a blood clot in the brain. So you get a blood clot in one of your vessels, and one of the arteries, and then the blood can't get to part of your brain, so that part of your brain stops working properly, and that's why you have all this weakness on your side, is because that part of the brain is not getting blood anymore. And so tPA is a clot busting medication that we give to try to break that clot up so that the blood can start flowing again, so that you can hopefully start being able to move and speak normally again. If the medication works. And so the way that I like to think about this medication is is the way that people understand it, or something else that people have understanding of, is to think about it like Drano. So have you ever used Drano in your sink or your pipes or anything? If you have a clog, you pour the Drano down, you hope it's going to break up whatever's clogging your drain, and that the water will flow through. So this is a very similar idea. So you can think of the artery in your brain as like a pipe, and there's something blocking it right now. tPA acts like Drano, but just like Drano, there can be essentially kind of three options for what can happen when we give it. So what we hope happens is that the tPA hits that clot, and then like Drano, it breaks it up, blood starts flowing, and you start getting better. That's what we hope is going to happen, and that's what does happen for a lot of patients. The other two options are that we'll put it down there, it'll hit that clot, and just nothing happens. Sometimes Drano doesn't work, it doesn't bust up the clot or whatever's clogging the pipe, and nothing changes. So hopefully that's not the case, but that's one possibility. And then the third possibility that we take very seriously and always want to talk to people about is that it could cause bleeding. And the reason for that is, let's imagine that you have a clogged pipe in your house, but it's actually a really old pipe that's really worn down and it hasn't had good water flow in a long time. Now, if you all of a sudden break up the blockage to that pipe and you get really fast flowing water going to that spot, that old pipe might just burst. It might explode, and the water will start leaking out all over the place. Sometimes that can happen after giving tPA for a stroke. So if the blood vessel past where the blockage is has gotten very damaged, if it's already started to break down because it hasn't been getting blood flow for a long time, and we then break up that clot, sometimes that can cause bleeding because that vessel can burst just like the pipe in your house can burst. That's thankfully very rare. The chance of that happening, at least at our facility, is in the kind of range of 2 to 3%. So what that means is if we had 100 people come in with the exact same stroke symptoms that you're having right now, 2 of them would have problems with bleeding if we gave them this medication. So again, the chances that will happen are very low, but we do want to talk about it. And the reason that we think for you it's safe to give this medication is, 1, you're very clearly having a stroke, and number 2, thankfully you came in really quickly, so that the faster we give this medication, the less likely you are to have some of those complications of bleeding, because those are more common in people who get this medication much later, which is why we kind of do all these safety checks. So again, of the 3 options, of course, we hope it's going to work, and we hope it's going to give blood flow back and improve your symptoms and help this weakness get better. But those are the 3 things that can happen when we give this medication.